What we do know, certainly in New York City, and I want to say nationally, is that when you look at who is dying of overdose related to opiates, about 2/3 of those who are dying have polypharmacy, so meaning that they're using more than just one substance. And so one of the biggest substances that causes problems is benzodiazepines along with opiates. So what are benzodiazepines? Those are the brand names like Valium, Xanax, Ativan. And so the thing is, they work together, sort of they add to each other in the brain to both be sort of things that slow down the brain and slow down the breathing. And so the two of them mixed together can be really dangerous. In addition, alcohol, again, is the same kind of, has the same kind of effect where it slows people down, slows the brain down, and can also lead to, add to the whole effect of reducing the drive to breathe. So, we say, and again, this goes to, even if people aren't in treatment or don't want treatment, the message of, well, don't mix drugs. If you're going to use opiates, just use opiates. Don't combine it with a benzodiazepine. Don't combine it with an alcohol, because that's when people get in trouble. That's when people die.
Can I just ask, aside from mixing drugs, what are other scenarios that can increase your risk of overdose?
Right. So, the more people use, the higher the risk is, or the higher the dose of an opiate prescription, the higher the risk is. And one of the common scenarios that we will see, which is really unfortunate, is when people are coming out of treatment or coming out of a controlled situation. So people are coming out of jail, people are coming out of a hospital, or a detox program. And what happens is, while they're in this controlled setting, they're not able to use drugs. And so their body's tolerance to the drugs decreases. But then they go out into the world and they use the same amount of drug they had used before, thinking that their body can handle it in the same way that it could, but it can't. And so that's when people overdose, because they go back to the same dose they were taking, but their body is no longer used to it or tolerant enough to handle it, and then people can overdose and die.
What about using alone?
Right. So, definitely one of the messages for people, if they're going to use drugs, to not use alone, because if you're using drugs with somebody else and you overdose, then somebody else can save your life. Somebody else can call 911. Somebody else can use naloxone to reverse the overdose. But if you're using alone by yourself, there will be nobody around that can help in case there's an overdose.